In 2014, only 53% of low-income kids and 56% of low-income adults saw a dentist. That's according to the Massachusetts Health Policy Commission. And as a result, emergency room visits for preventable oral health conditions are 6 times higher for low-income kids, 7 times higher for low-income adults. Part of it is cost, but part is access. With 1/10 of the state's population living in an area that is federally designated as having a dental health professional shortage, that's why some state lawmakers are now pushing for a new dental classification called a dental therapist. It means someone with more training than a hygienist, but less than a full-fledged dentist. This group would be allowed to perform basic dental procedures like filling cavities, extracting teeth, but not everyone thinks that's the right way to go. Joining me to discuss the issue are Carolyn Villers. She's the Executive Director of the Mass Senior Action Council. Good to meet you, by the way. And Dr. David Lustbader. He's President of the Massachusetts Dental Society and a clinical instructor at the BU School of Dental Medicine. Good to meet you, too, Doctor.
Thank you.
Can you expand a little bit on what my description a minute ago? The one thing I left out, which seems to be pretty important under your approach to this, and a couple of legislators like Harriet Chandler, the supervision of this new person in the dental office would be general, meaning the dentist, him or herself, would not have to physically be there when they're doing this work. Is that accurate?
Yes, I mean, the scope of this bill would allow for general supervision after a certain amount of hours of full supervision, and the dentist, and it's up to the dentist to decide whether that's the agreement they want with the dental therapist.
Why do senior advocates care about this?
Well, there's a number of issues, and I have to say that I connect to this both professionally and personally as a single working parent that have had a challenge in getting access for my children's dental care. But one of the issues, certainly both for seniors and for young children, is being able to actually get to dental clinics. And for seniors, very few seniors in nursing homes get any care at all, and mobility and transportation is a huge issue.
Now, Doctor, I know you have a different idea, but before you tell me why you think you have a better idea, what's wrong with theirs?
Well, ours is, our idea is a little more comprehensive. There's nothing inherently wrong with theirs, but, those statistics you quoted earlier, they are disturbing on their face value, but they also mirror the population as a whole. So it's not, basically 50% of children, whether they have insurance, the best insurance or mass health, don't go get regular dental care.
Yeah, but I think the one thing you both agree upon, before we hear your alternative thing here, is there's not enough affordable access for enough people. And by definition, if we had dental therapists, there would be more access to more people. Why is that not a good idea?
We agree with the concept of a dental therapist, so that's number one. Massachusetts has the highest number of dentists per capita in the United States.
But those numbers are the numbers.
Those numbers are the numbers. They're actually better those numbers are better in Massachusetts than they are in other states.
But not good enough.
They're not. Ideally, we'd like to see it at 100%. But roughly 50% of the population in the United States doesn't go to the dentist on a regular basis.
But their goal again is to get more people to them. And I say again, my understanding is that the primary originally you just said this was a bad idea, the dental society. This year you got your own bill, and from what I understand, I'm surely not an expert in the area. I'm just a customer at these places, a patient, is the basic difference is they talk about general supervision, so that essentially once trained, the dentist wouldn't have to be there. You talk about more direct supervision where the dentist would have to be, which by definition, I'm not making a judgment call, means there'd be fewer additional people because available to provide service. Why is yours a better idea?
Well, the patient safety is really the first issue that we're concerned about. So the differences between the bills basically are educational standards and supervision standards, and then directed where people need to, should practice. So we're interested in providing for those shortage areas. There are 2 counties in the state that have shortage areas, the Berkshires and the Cape. So in our bill, they would require that they have master's level educations, that have more educational requirements.
And a dentist on the scene, which is a big
only for certain procedures.
One of the things that I think is
procedures.
important to recognize is that in Minnesota, where they already have dental therapists in place, the dental therapists actually attend school alongside dentists. They go through the same practicums, they take the same tests, and in fact, they actually spend more direct hours on the smaller scope of procedures than their dental counterparts, that actually pursue a larger scope. The other thing I just want to point out is that while statistics may show that there's only shortage in 2 counties, I can say for myself, I live in Dorchester. We have a number of community health centers. But while my children were on public health insurance, we had a real challenge in terms of access and care. My daughter went 3 months before she had an appointment. From there, our local clinic was not able to keep a pediatric dentist on. We had to go to Children's Hospital just to fill a cavity. That cost much more. It took another 2 months.
What do you say to her? I mean, my understanding is fewer than 40% of dentists take Mass Health, Medicaid, as it's called in Massachusetts, the contention being the reimbursement rate is too low. Why is your primary problem with this solution, because I assume you believe we should have greater access, is that you're concerned about the safety aspect? Is that where you're going with this?
We believe that there are certain procedures dental therapists can do under general supervision without
like what?
Any. Well, first off, screenings and anything that a hygienist performs. Irreversible procedures until you get certainly a track record. You know, the
is a cavity an irreversible procedure?
Yeah, sure it is.
Why? So
well, I think,
once you drill a tooth, you can't, and if you remove too much tooth structure, that can't.
Okay, so are his safety concerns misplaced?
Well, I can tell you as a parent, I'm a very protective parent, and in fact, one dental clinic that was available to us wanted to take my 3-year-old daughter in the back without me, and I left the clinic. So I think, I'm one of those parents that, and I feel very comfortable with this concept. I feel very comfortable with the dental therapist. I think that there's a couple of issues to look at. One is that there are public health, and I don't know if they're called hygienists or something, there are folks that come out to the schools, do screenings, and then refer people to clinics. The low rate of people actually, and particularly children, getting from identifying a problem to actually having it taken care of is a real issue. And so being able to provide that care on site is going to lead to better health outcomes.
I only have 1 minute left. What strikes me about this discussion is most people who are here to debate a measure on Beacon Hill are on different planets. I mean, one is this is the worst idea ever, this is the best idea ever. It seems to me, as a layperson, the space between the two of you is so pitifully small.
It is small.
So why is there not, in light of the fact there are a lot of low-income people and seniors who don't have dental, why are you not leading the charge to cut, I don't mean cut a deal in a pejorative way, to cut a deal that provides for enough safety?
We are negotiating, in fact, prior to coming here, I was at the State House for 2.5 hours meeting.
So will there be a deal that allows somebody, whatever they're called, who's not a dentist to provide a greater breadth of services than they're now able to provide in Massachusetts at the end of the day? Will that happen?
Yes, I believe that will.
I hope that's the case quickly if you can.
Yeah, so I think general supervision also allows extended hours and off-site. So it wouldn't require a dentist to be on site, so clinics could extend their hours into the weekend.
But he says that's not safe enough, and then the question is,
let's let those getting the care determine safety, and getting no care is certainly less safe.
Well, but you can't have a patient making a determination about whether or not the medical or dental procedures they're getting are safe. You would agree with that, right?
Well, I think that if somebody commits to this, and these are trained, certified people that have gone through all of the same trainings as dentists on these procedures and actually spent more hours on them.
We got to go. We'll continue this at some point. It's an important issue. Good to meet you. Thank you, Doctor. Good to meet you as well. Thank you so much for your time.